Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A lot of news. GoLocal's got the story of a cold case, a murder that took place about a decade ago outside of McFadden's, the old McFadden's in downtown Providence. That case has been solved, and they are trying to return that gentleman back to Rhode Island. Also, I want to thank Rebecca Cotto da Silva, who Skyped in from Bolzano, Italy. She gives us the updates on what's going on in Europe. Italian cases are going up and through the roofs. 90% of hospital beds are now filled. They are usually 4 to 6 weeks ahead of us on these cycles. So a little warning coming across, especially as Governor McKee's seems to be relaxing more and more regulations on the virus. And also want to thank Josh Short from the Wilbury Theater, who joined us this morning. 401 Gives, the initiative by the United Way, is coming up just on April 1st. It's a major fundraising event for all the nonprofits across Rhode Island, and especially for the hard-hit arts community who's just been devastated. An article in Crain's New York showed that about 70% of all people in the performing arts industry have lost their jobs, and it is unclear whether those jobs will come back anytime in the near future. But let's go to Dr. Michael Fine. He's the former Rhode Island Director of Health. Big news out of the White House. The president addressed the country for the first time. He made two bold statements, Dr. Fine. He first said on May 1st, regardless of age, condition, etc., you will be eligible for vaccination. Didn't say it would happen on May 1st, but you'd be eligible. And secondly, that in his mind, all Americans would be able to get together in small groups as early as July 4th. Two big, bold statements. The president's got to deliver on these. What was your takeaway, sir?
Well, they're great statements to hear, and they're really a vote of confidence in the vaccine. I mean, I think what we've seen in Central Falls and what we've seen in other places in the country is if you can get vaccine into arms, you can stop the spread of this virus. And so, it is a big, bold commitment, but one, if we can deliver on, really will make him kind of a hero for the United States for years to come.
Yeah, listen, all of us keeping our fingers crossed, it changes the timeline really from where we started the year, where the numbers look like we'd be at this all of 2021, maybe into 2022 to get vaccinated, that really most Americans who want to get vaccinated could be done really before July 4th. It's a big statement, and I certainly hope that he's got the infrastructure and the supply to be able to deliver on that.
Yeah,
Go ahead.
I'm sorry. And if he can, it will make a clear line in the sand differentiating Republican from Democratic administrations. You may remember that it was on March 6th of 2020 that President Trump and Vice President Pence got in front of the country and said they were ready to test. We had enough tests for all Americans, which turned out to be profoundly not true. Let's see if President Biden can deliver on his pledge.
Yeah, let's talk about, though, I skip the partisanship. Let's just go to America. Not exclusively, but these vaccines were developed primarily by American technology companies, pharmaceutical companies. And it appears that this breakthrough in science cut short the timeline in developing vaccines by years and years of what it normally takes. Is this a major endorsement of our science, our technology, capitalism, our rigor when we're focused on something? When you put all the best scientists on something, they can go and get something done.
Well, I don't think I can go that far. Remember, the Chinese and the Russians also have vaccines that appear to work.
Hold on right there. Are you willing to sign up for the Russian vaccine?
All I can say
because
the medical evidence suggests that the Russian vaccines and the Chinese vaccines appear to work. We'll have to wait and see what happens over time. I think it's an endorsement of science, and science ability to counteract these existential threats when it's put to good use. But remember, in the United States, we lost. We're gonna by the time this is done, lose between 600,000 and 700,000 people at least, and that doesn't compare well to what other countries have done that don't use our capitalistic democratic approach. We did not do well in the short run, and so the comparison isn't so straightforward. I'll tell you, Josh, one thing that I'm very pleased about. You know, what in the stimulus package. The one thing that happened in the stimulus package that really quite excites me is, as I understand it, there's basically a guaranteed annual income for families with children. That is a huge step forward if we got it done and if we can make it work. Because one of the things this pandemic exposed about us was that many of our school kids were being fed by their schools, that their families couldn't afford to feed them. I've been pretty critical of our not rising to the top and dealing with the problems that this virus unroofed. But boy, if we can make sure that every kid has enough resources in their own family to be fed, that's a giant step forward. Now all we have to do is housing and education, and we're really in good shape.
You make a very good point. I do want to go back. It is my understanding that both in Russia and in China, if you criticize the vaccine, you'll spend a number of years in cold weather environments rethinking your criticism of those vaccines. So if you are contemplating taking one of those vaccines, do it by mail order. See if Amazon delivers, because you don't want to enter either one of those countries and try them out and then criticize them there. Let's go to Bolzano, Italy. It is a little chilling. We're feeling good about things. You know, the stimulus package, which takes a lot of the pressure off the states financially, cities and towns, states' response to this pandemic. Secondly, the president now is making a very, very big promise on a new timeline. Thirdly, it's Rhode Island and it's March and it's gorgeous out. We feel good about things, but we talked to Bolzano, Italy today. Generally, through the past year, they're about 4 to 6 weeks ahead. They got hit hard by the pandemic in February. We got hit hard late March into early April. It took place again over the course of the fall and the winter. It's almost exactly a mirror of each other, 4 to 6 weeks apart. They've been in lockdown for about 4 weeks. Their cases are still going through the roof. The hospitals are 90% filled, those beds dedicated to treating those suffering from the virus. And more and more regions of Italy are being identified as code red by the EU. It's a significant problem. Here, Governor McKee has announced further relaxation of restrictions. He made them a couple weeks ago. Governor Raimondo did out the door. Cases are still rock solid. New cases every day, 300-400 new cases, more deaths every day. Are we tempting fate here in Rhode Island with this McKee loosening the restrictions strategy at a time where we don't know the future of these variants and the potential for a third wave?
Yeah, I think we are. And, we are, our colleagues in Texas and Mississippi are. I can't predict what's going to happen, but I would think that we would be way better off with an abundance of caution approach, which would say stay where you are, get the population vaccinated, and then think about loosening up. Remember, surveys suggest that 25 to 30% of the population is not going to want to get vaccinated. And this disease can continue rampaging through that population if we loosen up.
Dr. Fine, you get the last word. We're going into this uncharted, still a high level of caseloads. Vaccination program is improving significantly. Governor McKee certainly, if you go by Governor Raimondo's rules of how she would take credit for victories. I think it's fair for Governor McKee to do the same. We were about 50th when he took office. We're now in the top 10 of getting percentage of folks vaccinated. Are we moving fast enough to avoid a disaster? And what's your suggestions to Rhode Islanders?
Well, I can't tell you yet whether we're moving fast enough. I think we're going to slow up for a bit because we have only 104,000 people who have had who have had 2 shots, which means there are 150,000 Rhode Islanders still to get a second shot. That's going to take a lot of work, and the first shots are what matters. We need to stay careful, and we need to keep our eyes on the prize, which is, getting rid of this virus so we can get back to normal. Our colleagues in Brazil who have taken a hands-off approach to all this, they now have more deaths every day than we do in the United States with a somewhat smaller population. And if we're not careful, we're going to see first Texas and then Mississippi and then Rhode Island end up like Brazil and like Italy if we don't keep our eyes on the prize and go the distance. We got to go the distance. Mask, social distance, get vaccinated as soon as you can, please.
Dr. Michael Fine, I want to thank you so much. Thank all the guests today. Josh Short from Wilbury Theater, Rebecca Coto da Silva giving us a report from Bolzano, Italy, and of course to Dr. Michael Fine, who has been a tremendous Sherpa for all of Rhode Island in guiding us through this terrible pandemic. For everybody, more news coming up on GoLocal. Keep an eye out and stay safe this weekend. We'll have coverage all weekend, and I hope everybody enjoys the weather but does it smartly. Wear the mask. I got home yesterday, took the dogs out. Here comes a family bouncing down the street, not a one of them wearing a mask. It's great weather. The virus is still here. Please, please stay safe. Please stay healthy. Please wear a mask.
And get a shot as soon as you can. Thanks, Judge.